Hello, it is now 2 p.m. Eastern Time. You have joined the JMHCP Gender Responsive Services Learning Community. To allow for additional sign-ins past the hour, we will start in a few minutes.
Yeah, I see them focusing on doing that a little bit more this year than they did last year and years before.
Hello, everyone. It is now 2 p.m. Eastern Time. You have joined the JMHCP Gender Responsive Services Learning Community. To allow for additional sign-ins past the hour, we will start in a few minutes. And just a heads up that no one is being muted when they come into the learning community, so just be sure to mute yourself if you're not speaking yet. We're going to get started in a few minutes. Good afternoon, everyone. Thank you for joining today's JMHCP Gender Responsive Services Learning Community session. This learning community is for Justice and Mental Health Collaboration Program grantees from the Training and Technical Assistance Provider, the Council of State Governments Justice Center, through Bureau of Justice Assistance funding. My name is Felicia Lopez-Wright, and I'm a policy analyst at the Council of State Governments Justice Center. I will be facilitating today's session along with Allison Upton from the CSG Justice Center and Becky Ney from the National Resource Center on Justice Involved Women. Next slide. To give you an overview of today's session, first we will do introductions and review the learning community expectations. Next, we will review the beliefs and data on responding to rule-breaking behavior. Then we will complete a poll and have a guided discussion. We will introduce the gender responsive approaches to women's rule-breaking behaviors. And lastly, we will wrap up and provide a resource to review for our third session on July 8th. I'm going to also just review some quick housekeeping items, which we also chatted out into the group chat. Everyone is unmuted upon entry, so that gives you the control to unmute or mute yourself throughout to allow for more participation. Just please be mindful of that and just make sure to mute yourself when you're not speaking to reduce any background noise or feedback. The best way to get our attention throughout the session is to type your question into the chat box as we'll be monitoring it. Or actually you can really unmute yourself and jump in. We really don't mind. We want this to be more of a discussion than us speaking at you. So please don't be shy. If you want to unmute yourself and speak, that's fine. We will try to reply to technical questions in the chat, but for content-related questions, we will stop and try to answer them as they arise, of course, keeping in mind our time for today. If we unfortunately don't get into your question or get to answer your question, we will keep a running list of them and address them afterwards via email. We will do our best to answer your questions throughout the session. If you encounter any technical or audio problems during the session, please, you can call Zoom live support. We have the number in the chat, but it's 1-888-799-0125. Please understand that there might be some technical issues that you won't be able to resolve, but we are recording the PowerPoint slide and audio portion only of the session, and we'll send it out to attendees by the end of next week. Next slide. All right, great. So we wanted to just move into some brief introduction of us as facilitators for the session. Like I said before, my name is Felicia Lopez-Wright, and I am a policy analyst at the Council of State Governments Justice Center within the Behavioral Health Division. I provide training and technical assistance to JMHCP grantees. And prior to joining the Justice Center, I provided outpatient mental health therapy to youth, adults, and families. And I also am a licensed clinical social worker. Becky?
Good afternoon. I'm Becky Ney. I'm the director of the National Resource Center on Justice Involved Women. I've been involved in working with women for many, many years, and I'm looking forward to today's session because I've spent about the last 30 or 40 years working with agencies to develop appropriate responses to technical violations and the like, whether on probation and parole in institutions, in jail, or in other criminal justice settings.
Great. Hi, everyone. I'm Allison Upton. I'm a project manager here at the Council of State Governments Justice Center, and I work in the Behavioral Health Division as well, along with Felicia. And I work primarily in the area of training and technical assistance for JMHCP grantees, so get the chance to work with some of you directly, and also to oversee some of the other technical assistance aspects for this particular grant track. And my background in training is as a clinical psychologist, so I worked in that arena as well before coming to the Justice Center. So welcome today and looking forward to the session. I'll pass it back to Felicia.
Thank you, Allison. Next slide, please. So I wanted to just briefly recap the expectations for our learning community, expectations that we have of U.S. participants, and what you can also expect from us as facilitators of this community. As you all know, there's a total of 4 sessions. We kicked off in May. Today's our 2nd session, and we have 2 more coming up in July and August. You should all have received meeting invites for these sessions. If not, please let me know in the chat and I'll add you. So what we expect is for each grantee team to really take advantage and participate and engage in these sessions. Just to be quite frank, the opportunity is going to be what we all make of it, meaning that the more that you all actually participate, the more learning we will all experience. And we also, we made the decision to use Zoom to further foster that increased interaction and discussion. So if you're comfortable, feel free to also turn on your Zoom video to enhance communication. Like I said before, we're only recording audio and the PowerPoint. We're not recording folks' faces or video on that end. So if you feel comfortable, that's just a nice touch. We also chose to use Zoom to allow these sessions to feel more like a learning community versus a webinar. And in between sessions, you can expect emails from myself, Allison, and Becky regarding relevant resources for upcoming sessions, questions to consider, or other activities that we feel will be beneficial in the learning process. Next slide. Okay, so now we're actually going to move into a brief team roll call. I know in our first session it was a little bit more detailed, but today's will be more of like an attendance call. So I'm going to go through the grantee team list in alphabetical order. So when I call out your team, just feel free to unmute yourself and state who's participating in today's session and your role on the grant. We did have 2 grantees that unfortunately weren't able to make our first session that I think are on today, which is Bureau County and Marion County. So when I reach those grantee teams, just be prepared to discuss a little bit more and share a little bit more about yourselves, so that way the rest of the group can get to know you. Okay, great. So we're going to go ahead and get started with Bexar County.
I'm Kathy Johnston. I'm the case manager for the Bexar County Felony Women's Mental Health Court. And I'm the only one attending today. The other ones are getting ready for court again. So,
Oh, wow.
Sorry, you're just stuck with me.
No, welcome, Kathy. Excited that you're on today. Thank you. Happy that you were able to make it. Great. Next, we have Bureau County, Illinois. Anyone from Bureau County on? If you are on, you might be muted. Okay, we'll circle back just in case. Next, we have Marion County, Indianapolis Sheriff's Office.
Hi, this is Callan Carr. Can you hear me?
Yeah. Hi,
Okay.
Callan.
Hi. I want to
Hello.
apologize for missing the first meeting. I was double booked that day on a COVID grant related matter, so I do apologize. I did catch up.
No worries.
watched the first session. So
Oh, great.
it was super informative. A little bit about our project is we are kind of in a unique position in Marion County. We are building a new jail facility. And so we were actually fiscal year 16 grantees. And in 16, we did, with our award that year, we did an in-depth data analysis and actually merged mental health data with arrest data, and found that, I think as we all know, that mental health has a significant impact on rearrest. So we wanted to take some of the things that we learned from the first session, or the first grantee award we had, and implement them this time around. And like I said, we're in a bit of a unique circumstance because we have a new facility being built. We are scheduled to move in 2022. And it actually has a dedicated reentry space. So we wanted, with this first couple years of funding, to partner with Aspire. They're a community mental health center that we work with quite a bit already. And we wanted to really dig deep and pilot some things that we can put into place in that reentry space, so that we can kind of hit the ground running as soon as we move in. And I have with me today Chelsea Teddy. She runs a program in our jail currently. It's called the STOP program. And she works specifically with women who have been victims of sexual violence, and also have identified substance use disorder. So we have found in past initiatives, anytime we try to do anything with women, and with this grant award, we committed to focus on women. And we find that anytime we institute services in the jail that have to do with women, there is significant overlap with Chelsea's clients and her population. So we always want to involve her in the early stages so that we make sure we're leveraging our resources appropriately. It was mentioned in the first session, and I think as we all know, that women have many needs, and we find that a lot with the work that we do. So we found it's better to involve Chelsea early because she knows her population, she knows what they need, and I think she'll be a significant resource for us on this grant.
That sounds fantastic. Wow. Awesome. I'm so happy that you all were able to make it today and that you will be participating in this learning community. And congratulations for that focus that you have on committing to focusing on women and that reentry space. That's going to be key with Connections to Care. So kudos. And also kudos with being named Stepping Up Innovator County most recently as well.
Oh,
so you all have a lot going on.
We
Congratulations.
do. Thank you.
Awesome. You're in good company. All right, now we're going to move next to Newcastle County, Delaware. I think if you're speaking from Newcastle County, you might be on mute. Alan?
Sorry about that.
It's okay.
Yeah, computer setup doesn't work on Zoom very well. Sorry about that, everybody. This is Lieutenant Herring, Police. I have my partners here that work on the team, Officer Omari George, Officer Colleen Kearns, and then our social worker, mental health professional, Alex Schofield.
Great. Thank you guys for making it. I know there's a lot going on right now. So we appreciate your time being on the call today. Great. Next we have New York State Unified Court System in Buffalo, New York.
Hi, it's Alicia Tabliago from Buffalo City Court. I'm the resource coordinator for the Buffalo Human Trafficking Intervention Court, and I'm the lead on the grant. We also have on the call Alicia Colhagen from Evergreen, who is the clinical treatment agency who will be providing a clinician on site in our trafficking court to link participants with trauma treatment, mental health treatment, substance use treatment, and trauma intervention, of course. And really our hope is to fill in the gaps that we're noticing with people taking that next step to access necessary treatment. And just to give another part of the overview for our grant, we're looking at sustainability as far as trying to train our local treatment providers to provide trauma-informed care, you know, from A to Z, from everything that they do in their agencies, from the minute someone walks in the door to calling on the phone, to accessing treatment. That's our sustainability plan for our grant going forward. And that's probably the last half of our grant, but that's what our overall plan is with our award.
That's excellent. Yes, training is the best way to sustain those lasting changes. So congrats. Thank you. Next, you're welcome. Next, we're moving to New York State Unified Court System in Rochester, New York. Anyone on from Rochester? Okay. Next slide, please. Next, we have Palm Beach County Sheriff's Office in Florida. I know we have folks on from there, so whoever wants to talk.
Hi there, this is Danielle Willette. I'm the grant project coordinator. I'm a licensed clinical social worker, and we have a group. I work with the Palm Beach County Sheriff's Office in the Behavioral Services Unit. So we also have partnered with our evaluation from Florida Atlantic University, and we are actually our goal is to prevent school and community acts of mass violence. Also to achieve partnering with the community stakeholders through a formalized committee, which is focused on increasing public awareness around identifying and reporting threats, and also on promoting available community resources for individuals who are experiencing challenges with substance abuse, mental health, and or co-occurring disorders. And for individuals who just may need additional support when it comes to reentry and recovery. So I think we also have on the line, I believe we have one of our Florida Atlantic University partners, Vaughn. No, maybe not.
Yes.
Okay.
Yes, I am.
There.
Yes, I'm here. I'm Vaughn Critchlow. I'm a faculty member at Florida Atlantic University, School of Criminology and Criminal Justice. It's a pleasure to be on and to be a part of this project with Danielle and others. And actually my colleague, who's also an evaluator, Cassandra Akin-Plunk, she's also on the call.
Great, welcome.
Yeah,
right.
I do want to apologize because I know Dr. Jenna Rollins and Lieutenant Randy Foley, for those of you that don't know, he's our project director, commander of the Behavioral Services Unit Threat Assessment. They were not able to participate today, so I apologize for that, but I certainly will keep them informed and updated of our workshop today.
All right, great. Thank you, Danielle. And yeah, we'll also send the recording and slides as well afterwards. So great.
Thank you.
Next, we have Richmond Behavioral Health Authority in Virginia. Is anyone else on from Richmond?
Hi, this is Dawn Farrell-Moore from Richmond Behavioral Health Authority. And I've got some of our team with us. Brittany Cox and Lauren Stevens are also on the call. We introduced ourselves last time, but we are part of a behavioral health docket, and we'll be sharing information from this learning collaborative with our team.
Excellent. Glad to hear it.
Thank you.
Awesome. And next, no problem. Next, we have Sonoma County Probation Department in California.
Yeah, hi, this is Allison Lobb. I'm a programs planning analyst with the Probation Department, and I'm the project coordinator for this grant. And so our project is a pretrial project that includes supported transitional housing and soon to be an additional community case manager to assist with people who are not, who either don't need the house or we don't have space for it. And so I'm really happy that that Zoe Jones is here today. She's with our community provider, Interfaith Shelter Network, and I have actually never met her, but I'm thrilled that she could be here, and I'll leave the rest to Zoe to introduce herself.
Thanks, Allison. It's nice to virtually meet you. I'm sorry that I wasn't available for the last meeting. I actually just found out about this from my supervisors this week. They told me I was going to be on the call, and here I am. We are partnered with Sonoma County Probation to provide a supportive living, transitional living space for homeless pretrial offenders who also have mentally or severe mental illness. So it's been interesting. We're about the first 6 months into our project, and we're finding, even though that it is co-ed, we're really lacking the women referrals, and we're not quite sure why. We've had 2 roll through, and they left within like the first week of being in the house. So it's been an interesting project thus far, and it will be interesting to learn a little bit more to see if we can fold more women into the project.
Yeah, I'll just add that that is on our docket. We're going to be meeting on that as soon as we can with the different, the jail person who's screening people and figure out what's going on with that.
Great, and it's awesome that you've identified that and you're tackling it, and we're here, especially Becky is here too as a resource. So throughout that process, if you have any things in specific that you just, it's such a, maybe a barrier for you or something you can't figure out throughout that process, please email us and we'll help. Great, thank you for participating.
Yeah, Felicia, I'll just sorry to butt in. This is Allison Upton, the other Allison. Hi, this is Sonoma folks, but we also have a resource. Actually, we did a whole session in an earlier year of the learning community about engagement of women in different, activities, and so maybe we can send that out to you too, just as a resource. But you're not alone, so I'm glad you raised it on the call today, in the session today. So.
Yes, so important. All right, next we have South Carolina, DOC.
Good afternoon, this is Brittany Soto. I'm one of the clinical psychologists for the Department of Corrections down here in South Carolina. Like I said last time, our grant is a partnership with the Department of Mental Health in order to provide services for our female inmates, both while they are incarcerated and to continue those services once they leave us and go to the community. That will include parent training once they leave the community, so that way they can re-enter their children's lives in a healthy manner and hopefully reduce recidivism back into the corrections.
Excellent. Thank you for joining today, Dr. Soto. All right, next we have Village of Orland Park Police Department in Illinois.
Hi, I'm Bonnie Hassan. I am the grant project coordinator, and I'm the director of outpatient mental health services for Trinity Services. Our grant is to develop a mobile crisis response unit, working with the Orland Park Police Department initially, and then expanding to 5 surrounding communities.
Great, welcome, and glad that you can make it today. Next we have Warren County Bowling Green Sheriff's Office in Kentucky.
Hi, this is Dr. Ben Stickle, and I'm joined today by my colleague, Dr. Mitch Miller. We're both working with the Warren County Sheriff's Department. We have a Category 2 Justice Mental Health Collaboration Program grant, and we're hoping to gain from this some knowledge and information for how we can structure the processes moving forward to highlight the needs of women and gender as a whole. Have had some delays, like many, trying to get things going with the COVID response and some other issues. So this is actually a good time because we're allowed to get some information that we can then implement in our plans moving forward. So we're very glad to be here.
Great, we're glad you can make it. And last but not least, we have Yolo County District Attorney's Office in California.
Hello, everyone. I'm Preston Schaub. I'm a prosecutor here in Yolo County. I am joined today by Joe Goki, one of our public defenders, and Jasmine Gonzalez, one of our probation officers. We also collaborate with our Health and Human Services Department, which I did not see a representative on the call today unless they're hiding somewhere from me. We are a collaborative court who specializes with mental health mental illness. We also have a sister court that deals with substance use disorders and other addiction issues. The same team manages both programs. Our job is to identify individuals in the criminal justice system that need that higher level of care and provide them with resources, case management, and also bring them into a collaborative court process where they get the benefit of the black robe effect and the judge and other members of the community in these positions of authority, giving them a more supportive system instead of a punitive system. So that's what we're designed to do. And in spite of COVID, we are up and running. Our court is back in session, doing informal sessions right now. We're going to soon transition back into a formal setting, but right now we're just utilizing Zoom to connect with all of the individuals and participants in the program and just kind of keeping tabs on everybody while we figure out how to navigate our new normal.
Great, thank you, Preston. I appreciate that and appreciate everyone for their updates and introductions of their teams. And it's nice to hear that things are slowly getting back to a new normal in light of COVID. Again, if you would like to read more about any of the grant programs that are participating in this learning community, you can refer to the list of participating grantees that I actually attached to today's meeting invite. So that's a helpful summary for all the projects that are participating in this community. So we'll move on to the next slide. Great, so I'm just gonna hand it over now to Becky to begin facilitating our discussion for today on responding to women's rule-breaking behavior.
Great. Thanks, Felicia. Let's move to the next one. Okay, about today. I'm not going to share any, even though the previous slide said data, I'm not sharing any data with you today, although I have tons of it. I think we could talk more productively about the principles and concepts about responding to women's rule-breaking behaviors, technical violations, some of you know them as infractions, violations, and I think even for those of you who may have had a chance to read the third section of the Gender Responsive Discipline Guide that was sent out, that guide was very much focused on women's prisons, which there is one grantee in women's prisons, also applicable to jails. But I think the concepts that were raised in that third section are very applicable to each one of the criminal justice points that you all sort of are focused on. Everything I talk about today is based in research, evidence-based. I may challenge some longly held beliefs. I hope there will be some discussion about some things in that regard. And lastly, I would just say, I think some of the things I'll talk about are probably less relevant to law enforcement and crisis intervention approaches that many of you are taking. However, just know that our next session, our third session, will be entirely focused on law enforcement. So I think just listen. So I ask you all to sort of listen carefully about your programs, your grants, the things you're trying to do, and which of the principles we talk about today that may resonate with you, okay? So with that, let's go to the next slide. Just a brief refresher. I think in the corrections and criminal justice world, we are all about trying to implement evidence-based practices. My assumption is that we are all interested in reducing women's recidivism and their involvement in criminal justice. And so the gender neutral research, which is relevant for men as well as for women, just as a brief refresher, suggests that we use a research-based risk and needs assessment tool so we can identify the level of risk that men and women pose, and we can identify their needs, which if we can address them successfully should reduce their risk for reoffending. And so in that regard, we want to target the higher risk individuals. We want to target their needs per risk assessment, If you're using a gender responsive risk assessment, risk and needs assessment tool, all the better for women especially. We're finding that there are different criminogenic needs that are more associated with risk of recidivism for women than what we find on the gender neutral tools, although those are still relevant for women. I think in treatment, obviously we want to use a cognitive behavioral approach. And most relevant for our discussion today about sanctions and incentives, I think we want to talk about, and perhaps many of you are doing these in your programs, thinking about how we can provide more incentives and rewards for motivating women to change than disciplinary sanctions for breaking the rules, okay? And we have to make sure that we have very well-trained staff who know how to work with women, who are trauma-informed, who understand women's pathways, and I'll say, and taking care of staff who may themselves have their own trauma and past victimization or secondary kinds of trauma that they may have as well. So we want to make sure we're paying some attention to staff. So all these things in a gender neutral world, men and women, hold true in terms of the evidence. And with women, we want to do all those things, but we want to add gender responsive and trauma informed approaches, okay? So that's my like 5-minute summary of everything you need to know about evidence-based practices, right? That's a very brief overview, but I thought it important just to lay a little kind of a background. So as we begin to talk about violations and where that fits into this bigger picture of working with women. So let's move on. And again, I invite you all just to stop me at any point, okay? So in that evidence-based world, what I find around the country in my work with corrections agencies, with community corrections agencies, with law enforcement, with treatment providers, is that we're all about the business of trying to implement what we know to be the research and evidence to help women heal, to reduce their recidivism. But when violations occur, we very quickly retreat to a punishment mode. So we don't necessarily apply evidence-based approaches when we see rule-breaking behavior. We tend to use punishments. I'd be happy to hear, and we have a little chance to talk a little later on about what you're doing about some of those things. And what I also observe, having worked with jurisdictions, again, for a very long time, many provide little or no formal guidance to staff about how to handle these cases. Some agencies may have some structured responses that they expect. Some have maybe had some discussions about let's make sure that small infractions get small responses and big infractions get big responses. But not everybody has done that work, and typically it's left up to the individual case manager to decide how to manage the case. So, so let's move on. And even if those agencies have talked about how we're going to respond so that there's some consistency across violations, right? Consistent, fair. We want to make sure that things are proportionate, you know, all those things that we value in criminal justice. But even if we find we're doing those things in agencies, we find that policymakers may not have any of that information. So we're not talking to them. The judge may have a different idea about how he or she wants to respond to a violation than what our agency policy says, if we have one. A district attorney or a prosecutor may want to respond in a different way than a public defender or other. And so I think it's important, especially in the collaborations that you all have talked about, to have some conversations about how are we responding when women break the rules? How are we responding? Very difficult in correction settings and very difficult in community corrections or court settings as well. Some entities where there are structured responses adhere to what I will call graduated sanctions responses. So if the first response is going to get a little response, the second violation is going to get a little more, the third violation is going to get a little more, and 3 strikes you're out, you're going back to jail. So we graduate those responses, and and I want to talk a little bit about graduated sanctions because there is absolutely no research that supports graduated sanctions, even though it is a common practice and an accepted practice among criminal justice agencies. And certainly for women, what I find, or maybe you will tell me I'm wrong in the programs that you run, I find there's absolutely no consideration of gender responsive or trauma-informed approaches. So in this whole area of responding to rule-breaking behaviors, what we find is that it's fairly gender neutral. So we might have a very gender responsive and trauma-informed program. But again, when it comes to rule-breaking behaviors, we often revert back to a punishment mode, and it's not in consideration of her past victimization or sexual violence or whatever the issue is that brought her to us. And so there's little consideration of those things in our responses in this part of the system. Okay, so let's move to the next one. So graduated sanctions. Have not been able to find any research anywhere that would support the use of graduated sanctions, again, as having the effect of reducing recidivism or gaining compliance for either men or women in supervision, in court programs, in correction settings. And certainly the rationale behind that is if a little punishment works, then maybe it's better. Or maybe we didn't give enough punishment, so if we give more, that will work. And what I find is, and certainly what some of the research bears out about punishment approaches is, and certainly my personal life, I have a son who has engaged in risky behaviors in the past. And when punished for that behavior, what I find is, and I think this, you may find this with many of your clients, I just learned how to do the same behavior and just not get caught. I'll just do it in a different way. Or I'll just comply for a little while, and then when I'm out of this program, then I'm not going to worry about it anymore. And so what I'm trying to suggest to you is we can punish people and get some short-term compliance, but I think what we're looking for actually is in the bigger picture, kind of a reduction in recidivism and helping them have productive lives outside of criminal justice. And that means keeping an eye on the larger picture about what's going to work to actually motivate and change behavior. So that's sort of what I'm about. And it's not about the particular behavior that's presented in front of you. It's everything that's going on, because there's usually not just one thing going on at any given time. There may be multiple things going on, or she may be doing very well in other areas, but is having trouble getting to court on time, or she may be having trouble with relapse or other things. But there are lots of things going on, and sometimes it's not just one rule-breaking behavior either. Often there are multiple things that are happening. Like I had a bad visit with my kids, so I'm going to relapse, but if I relapse, then I can't show up to court, because if I show up to court, then they're going to punish me, or they may take my kids away. So many different things are often going on. So just lastly, and I refer you to this resource, my partner, Mimi Carter, who has pulled all of the research together that we have about violations. And in that particular source, there are also some examples of structured sanctions in some different ways, which might be interesting to you. But lastly, I'd say about the research about graduated sanctions is it may in fact increase noncompliance or habituate individuals to certain responses. Like, okay, I know I did this, I'm gonna go to jail, so I'll either go in and get it over with, or I just won't come back in. So I'm used to it. And so eventually over time, some of these sanctions become meaningless, if you will, or I know that I can do that, but there's no real behavior change. So that's the news about graduated sanctions, which I know often is perplexing to people. So shall we move on? Unless there are questions, again, just stop me. Excuse me. So here's a little bit of summary of some data. Mary Morash, who's done a lot of work in Michigan, especially with women on probation and parole. And in her studies, she finds that responding to women's rule-breaking behaviors with treatment responses can reduce recidivism for some women. So that's good news, as opposed to a punishment response. Marilyn Van Dieten and her colleagues in some studies that have been done on the collaborative case management model for women that the National Institute of Corrections has put out, and their studies found that a collaborative holistic case management approach, of which several of you describe in your approaches to working with women, have had a better recidivism reduction than those women who are not in a case management approach that's holistic, that's working collaboratively with partners. So that's more good news. But I think understanding the context of women's relationships, their past trauma, their past victimization, can help us respond more effectively and not to trigger the trauma behaviors. Many of you have talked about and are very knowledgeable about the trauma that women have. And I think we need to think about responses to rule-breaking behaviors that don't destabilize her, that make things worse, that really undo everything we're trying to do with her. So I guess the real question is, how do we begin to do that? All right, shall we go? What I find in community correction settings, in pretrial settings, in even in specialty court settings, correction settings, there are a ton of conditions and rules, lots and lots and lots. And I will tell you, I would not be able to comply with all the conditions that we put on people, women. And so just think about what's most important to you. What are the things that you really want her to do? What are the things that you're willing to let go? And I don't really mean let go, because one point I really want to make is that we must respond to all violations, period. We must respond. But there are many, many, many different kinds of ways in which we can respond that don't involve adding additional conditions, adding additional rules, and really consider what's this particular sanction or response to the rule-breaking behavior, what's this going to do to everything else in her life? Because what I find in criminal justice that we often, for the best intentions of wanting to keep her safe, of wanting to hold her accountable for her behavior, in reality, we may actually undo the things we're really trying to do. So I think we need to take some careful steps back and consider, what are we trying to do with rule-breaking behaviors? Many believe, and I tried to find some data. I have lots of anecdotal data, but I don't have a lot of hard, concrete, quantitative data that suggests that technical violations are an increasing cause of women's reincarceration. I know this to be the case in some states where I work in state prisons. It's the #1 reason why women are back in prison, is because they cannot comply with the conditions of their probation or parole. And I don't mean committing new crimes, I mean technical violations, meaning they're breaking the rules, but it does not rise to the level of a new crime. So I would also keep that in mind as well. Next. All right, so I want to talk to you all a little bit about what you're seeing. So let's go to the next slide. And just for our purposes, when I think I've done some defining of this already, I'm talking about infractions or violations or behaviors where you might find her out of compliance, that you feel may jeopardize her success in completing the program or supervision. Basically any kind of a rule-breaking behavior short of the commission of a new crime, okay? So with that said, let's go to the next slide. I think our poll. All right, so I think you all have, at least in the last session, we did a poll. And so check all it apply. What are the most common rule-breaking behaviors you observe among the women that you're working with? Do they miss appointments? Do they miss court appearances? Do they relapse or fail drug tests? Another one, do they fail to take prescribed medication? Do they fail to pay restitution, fines, or fees? Do they abscond? any other non-compliance about where they're living, curfew, being employed, walking away, refusing a referral, or any kind of verbal rule-breaking behavior. And I sort of kind of put that in for the jails and prisons on the line, because this is one of the big common rule-breaking behaviors for women inside, disobeying an order or talking back or being disrespectful, and any others. So why don't you take a moment to complete the poll, and then we'll talk about them for a few minutes.
Becky, this is Allison. We're just, and to everyone, we're trying to get the poll to work. We're having a little bit of a technical difficulty, so if you could just hold on for a minute, we're going to try to make it work.
Okay. And if not, we'll just have a conversation about it.
Yeah, our Zoom expertise is growing day by day. The issue is we're trying to open up the poll, but we are not. Hold on one second. We're going to try one more thing.
I'm always so relieved not to be on the technical end of things. Shoo.
Yeah, it has to do with which devices we use, and so now we're switching to try to have a different person. Felicia, if you're able to listen, yeah, I can't open it either for the same reason that you can't. So we're going to try having Eunice, our Zoom
There it is.
logistics expert, going. There we go.
Okay, so just check off all that apply. What are some of the most common rule-breaking behaviors you see among the women who you are working with? And then you'll be able to share the results. And again, I realize some of this is not as relevant for the law enforcement folks who are on the line. But I think some of the concepts and principles we've talked about and will continue to talk about may be relevant to you, certainly in responding to crises in a trauma and gender responsive way. So do we have results that we can share with everyone, or?
What's been it? Oh, yeah.
I don't think anyone has filled out the poll yet, so I just wanted to.
Okay.
Oh.
It is open and everyone can fill it out now.
Great, thank you. So again, just click on the ones that are most common that you've seen. Allison, if you're talking, we can't hear you.
Oh, I'm gonna just call out. This is Allison Upton. I'm just gonna call out to folks. Can you all see the poll out there? Because we have the poll up, but we're not sure that people are voting.
I think some of us already did it. I did it on my end, so I don't know if it's not showing up in results yet.
Okay.
Okay. Thank you so much.
I did it on my end and it
Okay.
Not
showing up.
That's strange.
It pops up on okay too. So.
Okay.
Just make sure you hit submit once you vote.
Once you vote, just make sure you hit submit.
Okay. So it looks like folks are filling it out and submitting it. Okay. Well, while we're waiting for the results, why don't we start just chatting a little bit? So tell me what you said. What are some of the most common rule-breaking behaviors you see among the women? Anybody?
Hi, this is Zoe from Sonoma County. I think the biggest one that we bear witness to is relapse, and that ends up getting almost everybody back in jail, and recidivism is very high because of that. I mean, I checked all of the boxes, but that's the biggest one that comes to mind.
Okay. Relapse, yeah, is always a big one, right? What else? What else did folks say? I'm going to come back around and talk about, so what do we do?
I'm curious to hear from South Carolina Department of Corrections. I think we might be having an issue getting the votes. I don't know. It might be a Zoom issue. We're not able to see the poll results. So I'm curious to ask South Carolina, because I remember from last session I believe if I remember correctly, you brought that up as a significant issue around responding to rule breaking. So I was wondering what you all think if you're on the line. I think it would be Dr. Soto.
Hello, I'm sorry. I thought I unmuted myself. I had to step away for an emergency.
Oh, okay. Well, we were talking about rule breaking and common rule breaking behaviors for women that people are seeing in their programs or in their experience. And I was wondering what you've seen in your experience.
The majority of the rule breaking, you actually caught me at a very interesting time, because that's the emergency that pulled me away.
There you go. Real-time situation, right?
We see a lot of minor rule breaking. For instance, I received 7 incident reports for mentally ill inmates who were not dressed by 8 a.m. And, to me, this is okay, but now they have charges that will result in a hearing and can result in further punishment.
Right.
So we see things such as that. We see a lot of females who go to other buildings to check on their friends. We actually do see a lot of failed drug tests, but those individuals do typically seek out help from either the mental health staff or the addiction treatment staff.
Right. Okay. So that's very consistent with what I have seen in other female facilities. Women tend to have many more rule-breaking behaviors and violations, tickets, whatever you may call them, disciplinary actions for many minor kinds of offenses, like not being dressed by 8 a.m. in the morning, or being disrespectful, or being out of place somewhere where she's not supposed to be. And it can result in some pretty serious consequences. So when she may go up before the parole board, for example, parole board members are going to see that she's had lots of incidents in prison, and they may not be inclined to parole her, right? But that's different than aggressively having fights or doing other kinds of things. So, but they all get looked at sort of similarly. So yeah. So I might suggest in South Carolina, while I didn't suggest this for everyone else, but you might read the entire discipline guide. We've certainly been working with many women's prisons to redesign what that looks like. We also find in women's prisons that a fight, the response to a fight by women is often, the discipline or response is often harsher than what we see in the men's prisons, or defined in some different ways. So, so lots of things there that we could explore. But let's come back to some of the other, what are you all seeing, those of you who are in specialty courts, mental health, human trafficking, behavioral health? What are you seeing among the women in those environments, those situations?
Hi,
this is oh, go ahead.
No, you go ahead.
Oh, sorry. This is Alicia from Buffalo Human Trafficking Court. You know, I checked off everything on the list as well. But the one that sort of is a really, really hard one to navigate is exactly what you were talking about with these rule breaking, kind of like really minor infractions that get them kicked out of treatment. And it's such a hard, it's a fine line, and it's such a hard thing to navigate because you push the person too far and they're gone, but you also want to have some kind of boundaries with them and some kind of protocols with them. But the women I work with, they come from trap houses. The women that they are around all day long could be their best friend, or they could roll over on them. There's so many dynamics that are worse with female to female kind of environments that it causes so much frustration and just difficulty with someone trying to stay sober and move forward and progress. So we try not to put a lot of rules in our core, but even with the very little rules we have, we notice that they seem to check off everything on this list. And we're just so afraid that we're going to lose them and they're going to run and not come back and then end up working on the street again and being in a really unsafe situation. So our hands are sometimes tied.
Sure. Okay. All right. And who else? Somebody else was going to speak up as well.
Yeah, this is Joe Goki out of Yolo County. I'd say a common one that I see anecdotally, I would put it under a general umbrella term of non-engagement, and that can take many facets. And it's typically non-engagement in terms of taking medications, in terms of leaving programs, in terms of not showing up to probation interviews, court appointments. And I find a significant amount of that to be due to, significant depression or housing insecurity that our clients face. And so you kind of get into your Maslow hierarchy of needs, if you will. And all of a sudden, when you're concerned about where you're going to be living, what you're going to have to do to be in that living environment, if you're dealing with depression relating to past trauma, some of these other proactive requirements can fall by the wayside pretty quickly.
Right. Okay. So what are some of the things that you do? Like if she does relapse or if she does miss multiple court appearances, what do you do? I mean, I heard someone say, well, if she relapses, our response is to put her back in jail, or we try to work with her as long as we can, but at a certain point, it's a safety issue that we have to respond to. I don't know what you can do about the minor offenses. One institution I work with, they've said to all their officers, we're going to use verbal redirects. We're going to train you how to do that, but we're no longer going to do formal discipline for any minor kinds of violations. That's another response. That's been a culture and sea change for staff and for the women. But what else do you do? What do you do now?
This is Preston Schaub with YOLO. I wanted to kind of expand on what Joe was talking about, because we sort of have this weird transition period, right, where we first are trying to engage and get them into our programs. There seems to be this sort of like catch and release mentality. We get them placed usually directly out of the county jail. They are in a program for, a few hours to maybe a week or so. And then they walk away, start to abscond, violate supervised probation, things like that. And then we hook them on a warrant, pull them back into county again. Now we have them in county jail. They're decompensating with the mental illness because they're back in that facility. And we kind of start that process over again, essentially until we find something that sticks. And once we do have a level of engagement where we start to kind of get past that Maslow hierarchy of needs, we have them housed, we have food vouchers, they're starting to get basic resources, then the problem becomes interpersonal relationships with people inside the programs, getting along, trying to, you know, get that functioning adult sort of lifestyle going again. Right. And we don't really put them in custody unless we're trying to control them long enough to re-engage with them. And that seems to be where that tool sort of ends, but sometimes we have to do that multiple times, and it pays a toll after a while. You can see it.
Sure. Well, and I think you're right. Sometimes we have to focus on things that don't have to do with the behavior, right? So we may have to work with her on finding an appropriate and safe place to live. For women, it's not just about a place to live, it's finding a safe place to live. We may need to focus with her on having regular visitations with her children, because that's really sort of playing on her and affecting everything else that she's doing. So how can we work with her, and how often do we talk with her about sort of, we're going to be together for a while, how do you want to spend your time? What are the goals that you would like to achieve? Where do we start? Because there are so many issues and challenges that we all face and that she faces, it can be very overwhelming. So where do we start? And maybe if she is helping to direct where we start, she might have a little more engagement. Not saying it works, but I think our job is to figure out, as it sounds like all of you are doing, how do we continue to engage given the great challenges we have with this population, knowing that they might disappear, knowing that they may come back. And I think a lot of this is about the staff. So is it a probation officer, for example, who is skilled and knowledgeable about working with women? Or is she on just anybody's caseload and she may get transferred? Is there a way that we can build rapport in such a way that she sees us as those people who are really trying to help me, as opposed to, you know, those folks who are just trying to send me back to prison? You see what I mean? I mean, that's kind of, a black and white example, but I mean, I think there's lots of ways that we need to continue to think about how best to engage and do so in a way that's helpful to her. And I don't mean to suggest that this is simple. It's not. It's very challenging work. It's very challenging work. But in the context of understanding where she's been in her life, the things that she's experienced, the habits that she's formed over time, these are not things that are going to change, as you know, overnight. And will get in the way of her being successful. So we have to find, I think, those successes in small ways. So in terms of engagement, often I want to start with a positive thing. What's happening in her life that may be positive? I don't care what it is. And you may have to really, really find something, but it's always there. Start with something positive before you move into the, by the way, you haven't shown up for your appointments, or by the way, you have a relapse, but maybe she made a call to a referral. Maybe she had more time in between relapses this time. Maybe she applied for a job. Whether she got it or not, she applied. Maybe she stayed in an appropriate housing or has not gone back to seeing those folks that get her into trouble for a while. So whatever the positive thing is you can start with that. Because she doesn't often realize that there's anything positive going on in her life. She doesn't believe in herself to know that she can succeed. So starting with some of those things and working them to say, you know, that's a great strength. You went for the longest time you've ever been without relapsing, or you actually came into the office, you know, you didn't come in the last 3 times, whatever it may be. But I think helping her to be more aware of the things in her life, the behaviors that she has that you can begin to build on might help with some of these things. So let's move on a little bit, because I'm watching the time here. So I guess just my last question to you, do you think your responses are working? And lastly, I'd say, and I'm going to talk a little bit about this next, which is, whatever you're doing to respond to her behavior, and again, you must respond to rule-breaking behaviors, how does it reinforce the things you're trying to help her achieve, right? So I want to propose a concept, and I'll talk a little bit about this going forward, which is, let's think of responding to rule-breaking behaviors as part of a case management process. It's just another case management tool in your toolkit. This is an opportunity to help her identify her strengths, to help her apply or practice what she may be learning in treatment, to build on her strengths, right? So these are things that all can be responses to rule-breaking behavior, right? They don't have to be punishments. Right? So, and she may be looking for ways not to be held accountable, because certainly lots of people in her life have never held her accountable. So I think the boundaries, as someone said, are important, but I think there's lots of ways to hold on to boundaries and lots of ways to continue to reinforce the things we're trying to work with her on, and using this as yet another avenue to do that. Does that make sense? Make sense to folks? Okay, so let's move on in the interest of time, and then we'll maybe stop. All right, I think I've said all these things, so let's move on to the next one. I just would say women will break the rules. We all do, but women will break the rules, in part because women are trying to, or women will talk a lot, I think we said on the last call, because they're trying to establish a relationship, because women are very relational. So where is this boundary? Is this person someone I can trust? Is this person out to get me, or is this a person who is out to help me? Does this person really have my best interests at heart? So thinking about those things, but rule-breaking behaviors often are linked to all the things I think you know. Some of the rule-breaking behaviors we observe maybe have served them very well on the street. I mean, it's why they're still alive, but not appropriate in a criminal justice setting. So seeing them as survival behaviors as opposed to rule-breaking behaviors may help you then think about, how can I work with this really great strength, this survival skill that's kept her alive this long, and how can we turn that in a more positive way to serve her well going forward in a more pro-social way, right? And I think we shouldn't underestimate the role that we play in her life. How we intervene matters, right? We're not responsible for her behavior, but what we do can make things better or make things worse. If our goal is to change behavior, then we need to do a lot more incentives, affirmations, take a strengths-based approach, helping women mobilize their social supports. So talking with her about where any of her social supports might be in the community, and I imagine many of you are doing that, that can be helpful to her. Maybe it's an aunt who's always been supportive of her, who can help her get to an appointment. Maybe it's a church member, or maybe it's a formerly incarcerated woman who's made some positive strides in her life. I don't know who it is, but where are the social supports, not just sort of the formal agency ones, but the ones in her life that could be of help to us, okay? Let's go to the next one. All right, let's keep going. All right, I'm gonna skip these. These are sort of the points that were made in section 3 of the Just Discipline Guide, in case you had a chance to read it. But I'm gonna move to the summary slides that sort of summarize these things, which are, we have to realize that women's behavior is usually in the context of lots of things in the past and the current situation. We always ought to be about prevention. The best thing is that she comes in and says, I feel like I'm about to relapse. here are the things going on in my life. I mean, what a situation that would be if we could begin to help her recognize the signs and her triggers so we don't get to a place where we have to respond, but we can actually prevent things. Relationships are important. Understanding that staff are change agents. We can facilitate safety, we can make things better, we can make things worse. So let's carry on. I think you all have said at one time or another, trauma matters. Let's take universal precautions and assume every woman we deal with has trauma in her life and apply those concepts day to day and in all of our interactions. Routine procedures. How trauma informed are you? I mean, helping her gain some empowerment and self-efficacy are really important parts of responding to trauma. So if you're in a case management meeting and she walks in and there's 2 chairs, you might say to her, where would you like to sit? Now that seems like a silly, stupid thing, but it gives her choice. Or if there are more significant routines, like we have to do a drug test today. So let me talk to you about what the drug test is going to be like, where we're going to go, how that's going to happen, who's going to be with you. Then you talk about the drug test while it's happening. Then you talk to her after it's happened and you ask her, how was it? Was it okay? Do you have any concerns? What's going on? Those are, so you don't have to not do the things you have to do. You just do them in a different way that's more trauma informed, okay? And then I'm gonna just skip to 9 and 10, which is all about staff. I think it's really critically important that we spend a lot of time training staff about how to work with women, to understand what trauma is and what trauma triggers are, to understand where women have come from, to understand what a gender responsive approach looks like. And I think it's important that we hire people that actually want to work with women, because there are lots of people that really don't want to work with women. They really are. You know, it's a very challenging population. She's, as I've said before, and there are a lot of people who rather would work with men because men will do it or they won't. Women will say, why? Women are constantly trying to figure out where the relationship is and how to build trust. You know, they got very complex and challenging lives. And then I think it's really important that we provide support to staff so that they can do that work in the best way they can, and to understand that staff may have lots of issues in their own lives, that they may be triggered as well by just hearing about some of the stories. When I read really the case files of some of these women, as I know you have, I can barely believe that they're still standing on 2 feet. You know, what a marvelous thing that is, that they're still standing. And so that is a great strength, but we often see that is not a strength. So let's move on quickly. So prevention and balance. Again, as I said, let's reframe her behaviors as her best attempts to survive the circumstances of her life. And if we can think about those behaviors that we see right before us in the context of sort of a larger piece, maybe we can respond in some different ways that might elicit over time some different results. Obviously, we have to ensure that women have access to all the services, interventions, and approaches that support behavioral health. It sounds like many of you are doing that. It sounds like many of you are having collaborative case management meetings about her. You might include her in some of those meetings so that you're talking with her about how it's going and what she's seeing in with each of you, as opposed to talking about her and making decisions about what we're going to do. I think both are probably important. And again, look for all the opportunities where you can use positive reinforcements or rewards. Maybe it's a small goal. You know, let's try, you know, the next 3 weeks not relapsing. And if you can get through the next 3 weeks, what would be a good reward for that? Some of you, I think, can provide rewards, a gift card, a visit, a supervised visit with children. You know, some jurisdictions provide punch cards, like you have 4 clean urines, and in some cases, you know, women and men both have to pay for urinalysis. So the 4th clean one, you don't have to pay anymore, or waiving a supervision fee, or doing something that might be meaningful to her. So think about the ways, you know, we all respond better to positive reinforcement than we do to negative reinforcement. So think about what you can do to reinforce the behaviors that you want to see in positive ways, help her set small and meaningful goals, and then just lavish the praise. Sometimes just the affirmations, just the praise, just the, you're doing a great job, can be enough. Over time, it should be all that's required. But, in the short run, it may be, I got to pay an electric bill, or it's going to get turned off this month, or, whatever it may be that may be totally unrelated to the work you're trying to do with her, but in her real life will be the most meaningful thing you can do. All right, let's go on. So helping her, as I said before, she's not always aware that she has any strengths. People have been telling her she's, she's a piece of trash and no good her whole life. So helping her understand what her triggers are, which I know is a lot of the work that's going on in treatment, helping her gain awareness, certainly of her personal strengths. I mean, the strengths research that's being done by the Canadians right now is beginning to show that focusing on building strengths is even more powerful than focusing on needs to address recidivism. Helping her to develop coping strategies. So a lot of the work in case management, I think, is not just about talk, but it's actually doing the practicing. Modeling the behavior you want to see, and then helping her practice. So maybe a sanction would be, you went out with that friend again and she always wants you to do drugs. So what are you going to do the next time that, Ann comes by and says, let's go out and get high? Well, practice it. No, Ann, I can't get high. I'm in this program. No, Ann, I want to be sober. No, Ann, no, Ann, no, Ann, until she can say that off the top of her head without thinking about it. Or what are other kinds of coping strategies that she's learning in treatment that might become part of the response to any of the rule-breaking behaviors, right? This is what I mean. These are opportunities to take some of those things out of the treatment environment and help her practice them in everyday life. And again, let's reply to all rule-breaking behaviors. So I always like to say that the best violation is the one that never occurs, because we're doing our good case management work. And if we're doing that work best, then we should see reductions in violations. We should be developing trust and rapport with her. She should be seeing us as a part of her team and her support team, someone she can talk to knowing that she's not going to get slammed in jail or have some other horrible repercussion. But I can trust my case manager, I can trust my supervision officer to have my best interests. I know she or he is going to hold me accountable, but they're going to do it in a way that's helpful to me. Okay? And realizing that some of those things may not be great, but it'll be clear and consistent and balanced, if you will. Okay. Next slide. Sorry. Relationships. So again, model, facilitate, teach, monitor, healthy relationships. I have no doubt that many of you observe that the women that you deal with have very unhealthy relationships with other women, with partners and significant others, perhaps with children. And I think we have to spend a lot of time talking about what a healthy relationship is, what it looks like, and helping her to develop those pro-social relationships, because she's probably never had any. And she probably doesn't even know what that looks like, right? So if there are professional men in her life as treatment providers or as case managers, you're probably the most pro-social male she's ever seen in her life, right? Provide relational supports to her. She may need more time. What I find with women is they need more time to talk. They just do. Every probation officer, parole board member, corrections staff, everybody I've ever talked to said, these women just want to talk. So I think it's important to allow enough time for them to talk, to know when it's appropriate to say enough, enough, let's talk about how we can deal with that. And also not to be, you can be empathetic without being sympathetic, if you know what I mean. I understand your situation, but that doesn't dismiss or justify the behavior. So I think there are ways to be empathetic without disempowering her, okay? Talk to her about relationships that are important. I mean, often with women, it's their children, if they have children. Talk about healthy relationships and boundaries. And I think for women, safety is always the issue. How safe does she feel to come into the courtroom, into a probation office? How safe does she feel in the institution, in the jail? Ask her about it. How respected does she feel? Women often say to me they don't feel respected. People don't talk to me with respect. They yell at me. They tell me I'm bad. They tell me I'm a terrible mother. So think about how to have respect and safety at all times. Let's go on. And I don't think I have to say much about trauma. Obviously, just universal precautions means we're taking the approach that every woman we meet with has some trauma in her background. Again, build on her strengths. Make sure your staff are trained. Utilize interventions that hold women accountable but may minimize trauma triggers. I mean, sending a woman to jail because she's relapsed can be a very traumatic event and really serve to destabilize rather than stabilize. You know, I used to work with officers who said, well, I've been putting her in jail for like 10 or 20 days at a time because that's what we do. Well, how long do you think it takes to stabilize her in jail? Well, about 2 days. So why don't you put her in for 2 days and get right back in there and start working with her, right? 20 days has had the effect of destabilizing her. And then provide lots of opportunities for her to practice coping skills, mindfulness, helping her to regulate, which is a really important thing. Just even sitting in a case management saying, we're gonna start every case management meeting just by taking a relaxing breath before we even start to talk, just to ground ourselves, just to sort of bring it down a little bit. And now let's talk about some of the good things that are happening, and now let's talk about the challenging things that we have to talk about. I think you might find in that kind of a situation, you know, where you're kind of scheduling things in that way, you might have sort of very different conversations with them. Next. Always motivating and skill building, right? Always using affirmations as often as you can. Always motivating her in every way you possibly can. Always using opportunities to teach and reinforce skills. She's not very good at managing or regulating her emotions. So she's doing things to act out in either mental health or behavioral health ways, or in substance abuse ways, or in other harmful ways. So the more we can help her learn skills to cope, the more we can help reinforce those skills in meetings that we have with her, the more we can build her self-efficacy and her belief that she can be something different, the more we celebrate successes. You know, having everybody in the office come out and clap because she's come to the court like 5 times in a row, and the 5 times before that she never showed up. For example, you know, you just look for those things where you can celebrate small successes, whatever they are. And make sure that you're real clear about the rules and expectations, and that you apply them clearly and consistently and fairly all the time, right? Changing the rules midstream, or being clear that you have rules and this is how we're going to do it, but then going into the court and the judge does something completely different may undo everything you're trying to do. Next one. And lastly, just staff training. Again, do your work with staff. Staff need a lot of coaching. I mean, it's not enough to put staff in a classroom and train them about what it means to be trauma informed. I think learning how to operationalize that day to day is hard. So selecting staff who can be coaches and mentors are really important. Staff need help too. Support staff to address their own trauma and stress, their own burnout. Provide incentives for staff as well. You know, a lot of times I do training and staff will say, you mean I have to be nicer to these women than my bosses are to me? So think about how you're hiring and how you're incentivizing staff to do the work that you know needs to be done, right? And then obviously communicate regularly. All right, let's move on. Lastly, I think rule-breaking behaviors give you some great insights into her behavior and opportunities to reinforce all the things you're trying to do. Our responses, as I've said, should be a part of, but not separate from, the case management goals we're trying to accomplish. Next. The kind of collaborative work you all are doing, the holistic work you're doing, I think is really important. Use positive reinforcements, rewards, incentives to motivate behavior. I think what we find in the incentives world is concrete rewards like gift cards and things are really important at first. But as people go forward and you start to see some changes, then I think more positive affirmations should be enough. All right, next. So there's my little visual about this. Focusing on the women with the highest needs, doing your best collaborative case management work, using interventions to build on strengths and skill building, review and revise your case plan as you go forward. I know those are things you're doing, but think about how the violations, the rule-breaking behavior fits in all of that and is not a separate piece from it. Okay? I think I'm at my end, right? And I knew I would talk much more than I wanted to because I wanted to hear more from all of you. So what do you think? Yes, she really has talked too much. I have nothing more to say.
No.
What do you think? What are you going to take away from today? Are there things that you heard today that you might experiment with, try out? Have any flexibility that you can try some different things?
I really liked using the way you framed trauma-informed approaches and how simple it could be. And I especially liked starting with staff, and we have instituted both a peer support team and some mind-body skills classes in the probation department here.
Mm-hmm.
Great.
That's great. I think getting all the staff on the same page is really important because they know, you know, this probation officer or this case manager does it this way and this one does it that way. And, you know, it just sets you up for things that you know, just make everything harder. Anybody else?
Becky, this is Allison. I was thinking as you were talking about the example that you know, the team member from South Carolina brought about the write-ups with the 8 a.m. in the morning, and you know, I was just thinking that it's great to think, like you said, of where we have leeway and where you don't with certain rules. If that, you know, where you might have some wiggle room, and reimagining rules that you, or responses that where you can, or even eliminating rules where you might be able to. And I was also just thinking about that particular example because it just happens it's happened at many different agencies where I've worked. It happens everywhere, things like that. I was just thinking like maybe there's a way to say, instead of you're getting a write-up because you didn't get up, what's the reward that people get when they do get up? You know, or what could be offered to entice people to be up at 8 a.m. and ready to go, you know, something of that nature. That just came to
Well,
my
ask them. A lot of times pizza works really well. So if everybody's up at 8 a.m. and they're dressed this week, we'll have pizza night on Friday nights. It's a very inexpensive thing. And honestly, you can't imagine how well pizza works for women, especially women incarcerated. One institution I know, they're doing movie nights once a month. They're having special family days. So lots of ways, but you know, talk to the women, they'll tell you. They'll tell you what's important to them, because the worst thing you could do is provide an incentive that then is meaningless to them. So again, think about how you can reframe, as Allison said, reframe some of these things into positive rather than negative things. I think you'll get a little further with the women. I appreciate everything you all do. I know how hard this work is. I hope I've given you some food for thought today. And I think I'm turning it back over to Felicia or Allison.
That will be me. Thank you, everyone. Thank you, Becky, for the great discussion and topics today. Thank you, everyone, for participating and engaging. And sorry for our little technical mishap with the poll, but we worked through it. So I just want to quickly wrap up and just let you know that our third session is on July 8th at the same time. And our resource for review is a TEDx talk by Kim Bobuki, who is a detective at the Seattle Police Department, who has over 30 years of experience, and she's the co-founder of the IF Project, which is a gender-responsive program for women that are incarcerated, and she will be our speaker for our third session. She will be in collaboration with Becky. So we're really excited to have her on. She has background experience with law enforcement and a gender-responsive approach, and we thought that she would be the best fit to really give you all insight on that and to support your efforts with that. So I'll leave it at that. I always send emails and follow up, after our session. So just be on the lookout for those. But if you have the PDF pulled up of the PowerPoint slides, you will be able to click on that link. It'll take you right to the YouTube for her TEDx talk, which is excellent. So you get to kind of preview her a little bit before our next session on July. Next slide. Here's just some resources, and you can keep going. Our contact information, as always, and just another thank you and a reminder that I'll be sending out the recording for today's session within the next week or so, and we'll see you in July. Take care, everyone.
Thank you so much, everyone. Take care.
Thank you.
Thank you. Bye-bye.
Bye.
Thank you.